I'm going to be doing a head-to-toe assessment. Okay. Hi, I'm Kendall. I'm going to be your student nurse today. Could you verify your name and date of birth for me, please?
Allison Feldman, 9/16/02.
Awesome. So today we're just going to be doing a quick head-to-toe assessment. Do you have any questions before we start?
Nope.
Okay. So just observing the room. The room looks clean. There's no clutter and there's no hazards or any safety issues that I see. The patient looks alert. They look awake, able to hold an upright posture. They don't look like they're in distress. They look well-groomed and clean. There's no obvious breath or body odor. They're an appropriate weight for height, a good build. All right, so can you tell me where we are today?
We're in Alter,
And do you know why we're here?
head to toe,
Awesome. And can you tell me what year it is?
2022.
Okay, so patient is alert and oriented times 4. I'm not even at the thing.
There you go.
Okay, so patient's alert and oriented times 4. So have you had any changes generally just in your mood?
Nope.
What about with your sleep?
Nope.
Or just in general, any changes I
Nope.
should know about? Okay, so I'm just going to take a quick set of vitals, starting with your oxygen. I'm going to put this on your finger, and then I'm going to take your pulse. Actually, I'm going to put the oxygen on this finger because you have a watch on. But I'm going to take your pulse over here. Okay, so your pulse was 62 beats per minute. It was regular. I give it a 2+, and it was taken right radially. And take your oxygen off. That was at 100%, which is great, right where it needs to be. And patient's on room air. So now I'm going to take, also your respirations were 14 respirations per minute, and they were regular, deep, and unlabored. Now I'm just going to take blood pressure. Is that comfortable?
Mm-hmm.
Okay. And the patient's in an upright sitting position. Okay, your blood pressure was 112/70, and it was taken on your right brachial artery, and again, the patient was sitting. And that was taken manually. And now I'm just going to take the temperature, so I'm going to put the little probe in the protective sheath. It's going to go under your tongue. Okay, and temperature was 98.6 degrees Fahrenheit, taken orally. So are you in any pain today?
Nope.
Okay, and if the patient was in pain, I would do a cold spa. So I'm just going to do just a quick head assessment, starting with your head. It looks normal cephalic, normal shape. I don't see any bumps or bruises or lesions or anything like that. I'm going to put some gloves on. And I'm also going to put hand sanitizer and close the curtain when I entered the room previously. Okay, so I put my gloves on. I'm going to feel your head. Okay, I don't feel any lesions or bumps or masses or anything to be concerned about. Now I'm just going to take your temporal pulses. Okay, those are a 2+ and regular. And now can you just push your head against resistance for me on this side? Okay, that was cranial nerve 11, spinal accessories intact. And now I'm just going to touch your jaw and you can clench your teeth for me. Okay, it's cranial nerve 5, trigeminal is intact. Now I'm just going to palpate your trachea. Okay, trachea is midline. And now I'm going to feel your carotid pulses. Okay, that's a 2+ and regular. And a 2+ and regular. Now I'm going to listen for bruits. This is a bell. I'll warm it up for you. Okay. Sorry. Okay. Okay. There were no bruises present. Okay. Now I'm gonna move on. Feeling your lymph nodes, just let me know if you feel any pain or tenderness with any of this. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, and posterior cervical. So is there any pain with any of that?
Nope.
Okay. So now I'm going to change my gloves, put on new gloves, and move on to your mouth. So if you could just open your mouth for me. Okay, mouth looks pink, moist, and intact. No teeth are missing or broken. Now can you say ah for me?
Ah.
Okay, the uvula rises upon phonation, which is cranial nerve 9, glossopharyngeal. And now can you stick out your tongue and move it to the left and right? Okay, cranial nerve 12, hypoglossal is intact. And then if you had any problems with taste?
Nope.
Okay, and can you swallow for me? Okay, so cranial nerve 9 and 10 are intact, glossopharyngeal and vagus. And then if you had any problems with your gag reflex?
Nope.
Okay, so that's cranial nerve 9 is intact, glossopharyngeal. And there's no obvious breath odor or anything like that. So now I'm going to move on to your nose. I'm going to do your ears first. So do you have any ear pain?
Nope.
Okay, and if they did, I would do a cold spa. Do you have any difficulty hearing, or do you use hearing aids?
Nope.
Okay, and then we're going to do a quick whisper test. So if you could just cover this ear, and then just raise your hand, you can hear this noise. Okay, and the same thing on this side. Okay, great. So now that we're done with your ears, we're going to move on to your nose. So if you had any problems smelling?
Nope.
Okay, so cranial nerve 1, olfactory is intact. And then I'm just going to take a look up your nose. It's not working. I got it. It's not turning off. Okay, there's no deviated septum. Everything looks good there. And then can you cover one nostril and breathe in and out for me? And same on the other side. Okay. So now I'm going to move on to your eyes. So if you could just look straight ahead. Okay, and then can you just follow this? It's going to get closer. Okay, and pupils are, just look straight ahead, about 5 millimeters in diameter, and they're round, which is within normal limits. That's fine. So then pupils are equal, round, reactive to light, and they accommodate. Now if you could follow, I'm just going to move in 6 different places. Okay, so that was the 6 cardinal fields of movement. So cranial nerve 3, 4, and 6 are intact, which is oculomotor, trochlear, and abducens. So now, can you read my name badge right here?
Yes, Kendall.
Okay, and then I'm going to move far away. Can you read this?
Kendall.
Okay. So now, it's down. Move on to your skin. So just looking at your skin overall, it looks clean and healthy. I don't see any like lesions, cuts, scrapes, bruises, scars, anything I should be concerned about. I'm going to change my gloves, and I'm just going to feel your skin down here. Okay, the skin is uniform throughout, or the temperature is uniform throughout. Her skin color is appropriate for ethnicity. I'm going to test your clavicle skin turgor. Okay, so it's a 1 second return, which is within normal limits. And now I'm going to check for edema, arms, legs. Okay, there's no edema present. Now I'm going to check your radial pulses. 2+ and symmetrical. Brachial pulses. 2+ plus and symmetrical, and I'm going to do the capillary refill on your fingers. Okay, that's a 2-second return, which is within normal limits. So now I'm just going to tap your arms, and I want you to tell me if you feel it in one place or two.
Okay. 1, 2, 2, 1.
Okay, now we're going to do the same thing, but tell me if you feel a sharp sensation or a dull sensation. Okay.
Sharp. Dull. Dull. Sharp.
Okay. So now I'm going to move on, and we're going to do the same tests on your legs, okay? So just tell me if you feel it in one spot or two.
1, 2, 2, 1.
Okay, good. And now tell me if you feel a sharp or dull sensation.
Dull. Sharp. Dull. Dull. I meant sharp, sorry. Dull.
Okay, great. So now I'm going to feel your dorsalis pedis pulse. Okay. 2 plus. And symmetrical. And now your posterior tibialis. Also 2 plus and symmetrical. I'm going to do the capillary refill on your toes. Okay. That was a 2-second return, which is within normal limits. So have you had any shortness of breath at all? Have you had a cough recently?
Nope.
Any pain or tenderness in your chest?
No.
Okay, so I'm going to listen to your lung sounds. Starting in the back. Okay, so just take some deep breaths in and out. Okay, lung sounds were all clear and audible. There are no cracks or wheezing or pleural friction rubs. I'm going to do the same in the front. Okay. And same there. Lung sounds were clear and audible in all lung sounds. And one thing that I forgot to do earlier, I'm just going to take a look at your eyes again. So can you pull down? Thank you. I'm trying this light. Okay. Sclera is white, moist and intact, and your conjunctiva is pink, moist and intact. So now I'm going to listen to your heart sounds. Okay. Warm this up for you. Okay. So your aortic, pulmonic, herbs, tricuspid, and mitral. Okay, so I heard clear and audible S1 and S2 sounds in all appropriate fields. And then if I heard, I didn't hear any abnormalities, but if I did, I would have the patient lie on their left lateral side and I would repeat listening to all cardiac sounds with the bell of my stethoscope. So now I'm going to move on to abdominal. So have you had, actually first I'm just going to listen, so if you could lay down this way. Okay. Are you comfortable?
Yeah.
Okay. So I'm just going to listen to your abdomen starting in the right lower quadrant. Okay, bowel sounds were normal active. Now I'm going to listen for bruits with the bell of my stethoscope. So there's aortic, renal, iliac, and femoral. Okay, no bruits were noted. So now I just have a couple of questions. Do You can sit up if you want. Actually, you keep laying down. That'd be great. So have there been any changes in your bowel or bladder movements?
Nope.
Uh-oh. Okay, we're fine. Okay, any changes in your bowel or bladder movements?
No.
Okay, and what was the color and consistency, or what's usually the color and consistency of your urine?
It's usually pale yellow and clear.
Clear, yeah.
One of those.
Good, and then is there any pain or burning?
Nope.
Okay, and what's the color and consistency of your last bowel movement?
Brown and soft and smooth.
Okay, and how would you compare your fluid intake to your fluid output?
I drink a lot of water, so I use the bathroom a lot.
Okay. And now I'm going to palpate. So I'm just going to feel starting in the right lower quadrant. Looking for any masses. Just let me know if this is tender at all. Is that tender at all?
No, I just almost laughed.
Okay, I'm just going to palpate your bladder. Okay, the bladder isn't firm or distended at all. Was there any pain with any of that? Okay, good. So you can sit up, and then you can just swing your legs over the edge of the bed. And then, could you tell me just what you've eaten in the last 24 hours?
Okay, so let's see. For lunch I had, what did I eat? I don't know. A wrap. I had a wrap. And then breakfast I had yogurt. And then dinner yesterday I had Dorito. And then lunch yesterday I had probably another wrap.
Awesome. Okay, so now we're just going to do just like a muscle test. So if you could just pretend like you're brushing your hair. Okay, and then bend over and tie your shoes. Okay, and then cross your legs and uncross them. Awesome. Now I'm going to take your patellar reflex with my hammer. Okay, to the other side. Okay, I'd give that about a 4. So now we're just going to do some muscle strength. So can you just pull your arms in, it's resistance, and push them out. And then just squeeze my fingers. Okay, all upper extremities, I would grade a 5 in muscle strength. There's no weakness. And now for your legs, can you push them out and pull them back in and pretend like you're stepping on the gas. Awesome. So now I'm going to change my gloves again. And now can you just stand up and take a few steps around? Okay, so the patient was able to walk comfortably, no signs of distress or any pain while walking. Their arms were swinging symmetrically. And then, was there any discharge you noticed anywhere that we haven't assessed?
Nope.
Okay, and I didn't see any unusual discharge anywhere either. So now you can get back into bed. Now I'm going to lower your bed all the way down and put the side rail up if I had more than 3 down. Or for, you know what I mean. I would have those only one was down and the other 3 were up. Lower you all the way to the ground. Are you comfortable?
Yes.
Okay. Thank you very much. Let me know if you need anything.